are visible here. And in this picture, are you able to imagine this picture? It is the lateral surface, and it is the medial surface. We cut here the medial surface and remove superiorly. So you are able, to look at medial septal or medial surface and lateral surface both in this picture.
That's like this?
No. We cut the medial septum and rotate superiorly. The lateral surface is here, medial surface is here. We cut the inferior portion of medial surface and rotate superiorly. Can you imagine?
Yeah.
Oh, alhamdulillah. Now, if you look at here, for example, the anterior ethmoidal in medial surface, anterior ethmoidal in lateral surface. The posterior ethmoidal vessel for the medial surface, for the lateral surface. Okay? The sphenopalatine artery for the medial surface, for the lateral surface. Both of them are visible here. About the anterior ethmoidal in your book, you find this, that the anterior ethmoidal is coming to the lateral surface. After passing deep to the nasal bone, it is going to leave the nasal cavity between the nasal bone and the nasal cartilage. Come near the skin, and here we call the external nasal arch. Again, look at this picture in your book. It is possible when you are going to read, explain for you that the anterior ethmoidal artery come to the lateral surface and to the medial surface. After passing deep to nasal bone, it is going to leave the nasal cavity between the nasal bone that connect to the nasal cartilage. Go near the skin, and here we can call external nasal artery that supply the skin and all of the tissue here. About the vein, it is easy. Vein in the nasal cavity are visible here. Only you should know here an accessory nasal vein superiorly access to the cranial cavity, and inferiorly it is going access to the vein in the nasal cavity. So anterior to distal body you have accessory vein. It is a way that infection can spread. This picture is going to remember that anteriorly the vein are going to drain to the facial vein, and posteriorly they are going to drain to the retropharyngeal plexus, to the superior deep cervical vein. So they are going to access to the infratemporal plexus and anteriorly to the facial vein. About the lymph, about the nerve, only about the nerve you should know the first cranial nerve, we call the olfactory nerve, is going to innervate the nasal cavity, okay? Sympathetic and parasympathetic also are going to participate to innervate the nasal cavity. And the fifth cranial nerve, who is ready to give me the name of the fifth cranial nerve? Okay. You passed the head and neck?
Today I gave the exam.
Today. What's the name of the fifth cranial nerve? Trigeminal.
Yes.
Trigeminal,
You're
okay?
gonna fail.
He will fail.
The trigeminal is the fifth cranial nerve. This trigeminal is going to divide to three branches. The ophthalmic, the maxillary, the mandibular. So we call trigeminal. The fifth cranial nerve very soon divide to three branches. Ophthalmic, maxillary, mandibular. The ophthalmic and maxillary has some branch for the nasal cavity, not the mandibular branch. Okay? So the fifth cranial nerve we call the fifth cranial nerve we show by the this. Yes? we show here, divide to 3 branches. V1, V2, V3. V1 is ophthalmic, V2 is maxillary, V3 is mandibular. The ophthalmic and maxillary has some branch for the nasal cavity. Okay? Sympathetic and parasympathetic also are going to innervate and participate in the nasal cavity. So please remember, the ophthalmic, the maxillary that belongs to which cranial nerve? Fifth. Another cranial nerve that participates for smelling, the flex cranial nerve. Sympathetic and parasympathetic also participate. Okay, the parasympathetic is secretomotor. The sympathetic is going to participate in flowing of the blood. You get that?
Yes.
Only about the innervation, something that I explained for you in the class is enough. In your book, it is possible you find more. For your knowledge, you can read and study. But for exam, only you know the first cranial nerve, the fifth cranial nerve, and the sympathetic and parasympathetic are participate to innervate the nasal cavity. Okay?
Okay.
So the nasal cavity finished with this lymphatic node. The lymphatic of nasal cavity anteriorly are going to drain the submandibular lymphatic node, and posteriorly they are going to drain to the deep superior cervical lymphatic node. So about the lip of the nasal cavity, remember, anteriorly they are going to drain to the submandibular lymphatic node, and posteriorly they are going to drain to the superior deep cervical lymphatic node. It is enough. Nasal cavity finished. I want to start the larynx, but I think perhaps the larynx a little need your concentration. So it is better tomorrow I explain the larynx. Today, no, wait. Today I am going to explain the trachea and the lungs. It is easier. What's the time?